Hi, everybody. This is Dr. Natasha Hameed. I'm one of the MS neurologists at the Northwell MS Multiple Sclerosis Center here in Long Island, Great Neck, New York. And my topic for discussion today is recognizing other medical conditions and their effects on multiple sclerosis. So before we get into our topic of discussion for today, I did want to briefly highlight on the heterogeneity within the MS population. And you guys, several of you probably have heard this from your MS providers or friends and relatives that commonly stated that no two MS patients are alike. The concept of this heterogeneity is poorly understood. Common questions that arise, which we do not have any definite explanations for, are why do some patients get worse more rapidly than others? Why do some have more relapses than others do? Or why some may respond differently to the treatment for MS? It's because of this heterogeneity that it's also difficult to predict the course of MS, especially earlier on in the diagnosis. Several factors may play a role in the heterogeneity of the disease. And then taking into account our topic of discussion for today, could coexisting medical diseases and lifestyle factors affect the MS clinical course? So the prevalence of comorbidities in MS. Many people with MS have at least one comorbidity, even at the time of the diagnosis. What do I mean by comorbidity? Comorbidity is any illness that is not MS or a complication arising from MS. For example, it could be someone with a history of high blood pressure, hypertension, diabetes, high cholesterol, hypothyroidism, just to name a few. And although we understand that depression and anxiety can be intrinsic symptoms of MS, for the purpose of this discussion, we will consider them as comorbidities. So what's the prevalence of comorbidities in MS? Here is just a graphic presentation of it. Down on your x-axis, you have your comorbidities. On your y-axis, you have your percentage. So as you can see, the highest prevalence of comorbidities that we have in the MS population actually is depression, followed by hypertension, which you see here in this dark blue. They are followed by lung disease and anxiety and so forth. Several comorbidities can occur more often in the MS population than the general population, and these could include depression, anxiety, ischemic heart disease, inflammatory bowel disease, seizure disorders, and even sleep disorders too. So we'll talk a little bit more about some of these comorbidities in MS. Comorbidities and increasing age. So just like the general population, where we see that there's an increased prevalence of comorbidities as one ages, we see the same within the MS population as well. So here you can, what this graph represents is basically the lifetime prevalence of common comorbidities in people within MS group. So we have the ages 20 to 40, 44, and 40s to 60s, and 60 onwards. So for example, hypertension here in green, the younger population is around 9%. And as we grow older within the MS population, we see that there's an increased prevalence of hypertension. Same goes with hyperlipidemia here that you see. And then interestingly, you see where we have depression and anxiety pretty much stays prevalent throughout the lifetime of patients with MS. Autoimmune comorbidities. Autoimmune disorders are disorders where your own immune system attacks different parts of your body. So overall, most autoimmune diseases were seen to affect less than 5% of the MS population. Most prevalent were being psoriasis, which is an autoimmune skin disorder, and thyroid disease. When compared to the general population, there was an increased risk for inflammatory bowel disease, Also possibly an increased risk for uveitis, which is inflammation of the outer lining of our eyeballs, and also possibly increased risk of pemphigus, which is an autoimmune skin disorder. So what are the effects of comorbidities on MS? One, it can lead to a delay in diagnosis. For example, several of the symptoms that occur in patients with MS could be mistaken as being a clinical presentation of another comorbidity or possibly a side effect of medications that patients are on for other reasons. So they may lead to a delay in diagnosis of MS. There could be a delay in initiation of the different treatments, which we call disease-modifying treatments. There could be a greater chance of side effects from disease-modifying treatments, which can eventually lead to discontinuation. For example, a patient who has a known underlying stomach disorder and they start reacting to a medication with, having nausea, diarrhea, they're not going to tolerate it, and that's going to lead to them discontinuing treatment, which can in turn lead to increase in their relapse rates and increase in radiological disease burden, meaning increased lesions or spots in the brain. Over time, it can lead to increased hospitalizations, which can lead to accelerated disability, and then eventually increased mortality as well. Here's just an illustration of what we already discussed. So kind of in the timeline of when we talk about MS, it starts with symptom onset, which eventually leads to the diagnosis of MS, at which point we start patients on treatment, which is a disease-modifying therapy, and also start managing symptoms, symptomatic management, which could be their fatigue, their spasticity, their bladder symptoms. And then over the course of the disease, there could be relapses, there could be disability progression, and eventually it can affect quality of life. So again, how do the different comorbidities affect this timeline of MS? It can cause delay in the diagnosis. There could be a greater disability at the time of diagnosis. There could be a delay in initiation of the disease-modifying therapies and also higher rates of intolerance to treatment. There could be increased relapse rates, accelerated disability progression, and overall lower quality of life or increased healthcare utilization, and lastly, increased mortality. The effects of comorbidities on disability worsening. So physical comorbidities do affect disability worsening. In one particular study, it showed that with each additional comorbidity, there was an associated increase in the EDSS. So EDSS is one of the most common disability rating scales that we use in patients with MS. And it was estimated that having one comorbidity would lead to an increase in disability as large as 2 years of average worsening over time. And among specific comorbidities, it was the presence of an ischemic heart disease or epilepsy that was associated with higher EDSS scores, again, which is our disability score rating. The greater the number of the comorbidities, the higher the level of disability as well. So vascular comorbidities in MS. When we talk about vascular comorbidities, we're talking about patients with hypertension, patients with, different like heart disease, diabetes. So these are all vascular comorbidities. And the studies have shown that vascular comorbidities actually accelerate disability progression. And if a vascular comorbidity is present at the time of diagnosis, the median time to needing a walking assistance was 12.8 years compared to 18.8 years in those with no vascular comorbidity. So the mean difference between having vascular comorbidities and not having vascular comorbidities in the MS population and requiring a walking assistance was about 6 years. So smoking in MS, a very popular topic that comes about. So the risk of developing secondary progressive MS was more than 3 times higher in those who were smokers than in non-smokers who had relapsing multiple sclerosis at the clinical onset. So secondary progressive MS is where you start as a relapsing remitting MS course and then eventually leads to disability progression over time. So smoking was associated with an increased risk of converting from a relapsing MS to a secondary progressive MS. In patients with MS, smoking has been associated with higher lesion burden and greater brain atrophy, which is shrinkage of your brain. Cigarette smoking also increases the risk of converting from a clinically isolated syndrome to clinically definite MS. So clinically isolated syndrome is when individual presents with a single MS attack or a single clinical symptom, which, they, at that point in time, they do not meet the diagnostic criteria for the definite clinical MS. So they get diagnosed with a clinically isolated syndrome, which if they were to have another clinical attack would lead to a diagnosis of definite MS, which cigarette smoking can increase that risk of conversion. Psychiatric comorbidities. So depression, anxiety being the most prevalent amongst the psychiatric disorders. So having a psychiatric comorbidity can lower one's quality of life, can lower adherence to disease-modifying therapies. It can adversely affect long-term health outcomes, can cause worsening fatigue. So depression itself can cause fatigue. And of course, we know that MS can cause fatigue as well. Worsening in cognition, so memory, concentration, thinking. And also stress-related exacerbation. So stress can lead to, triggering your immune system in a way to lead to relapses in MS. So how do comorbidities affect how MS is treated? So existing comorbidities may influence treatment decisions and treatment goals. The choice of when we choose disease-modifying therapies, and it usually involves individuals' overall health. So if one has underlying history of hypertension, we would want to avoid treatments which could probably, worsen their hypertension, or if they have diabetes, lead to, or like kidney failure, liver dysfunction. So all of those, keeping all of those in mind, that's how we usually choose what treatment options we want. And of course, patient preferences, kind of play a role, and we're looking at the different adverse effect or side effect profile for medications, and also the route of administration. Is it injectable, if it's oral, or if it's like infusion therapy? So all of this plays a role when we choose disease-modifying therapy for patients. So furthermore, patients with certain comorbidities were actually excluded from DMT clinical trial. So it's uncertain if certain therapies are more effective, more tolerable, or even if they're safe within the population of patients with certain comorbidities. There was an Italian study which reported that of approximately 2,000 newly diagnosed MS patients, nearly 24% had at least one comorbidity that compromised their ability to tolerate their first treatment, their first disease-modifying treatment. And in another Canadian study, it showed that as a total number of comorbidities increased in an individual or in the group, the likelihood of starting a disease-modifying therapy actually decreased. And there was the comorbid anxiety and the comorbid ischemic heart disease were associated with the reduction in starting a disease-modifying therapy. So certain comorbidities might affect the safety, the tolerability, and effectiveness of disease-modifying therapies. Some disease-modifying therapies may increase the risk of developing specific comorbidities. For example, some may put a patient at risk of developing hypertension, or even some therapies can also lead to other autoimmune disorders as well. Making sure that your doctor is aware of all comorbidities is essential to ensure that the right medication is chosen for you. So the lifestyle tips, just a quick take-home messages. So making sure that you're keeping physically active, maintaining a healthy weight, keeping mentally active to help with fatigue, to help with cognition, avoid smoking at all costs, limit alcohol intake, and treat your comorbidities. Take your medications for your medical comorbidities, which are prescribed by your primary, your cardiologist, your endocrinologist, or any other specialist you're seeing. So just important messages and key. How can we minimize the effects of comorbidities? So you want to identify your comorbid condition as early as possible. Recognize the comorbid conditions can affect your disease course. So you want to make sure not only do you recognize them, or you make sure that you're discussing it with your primary care provider or your other providers, and recognizing that these conditions can affect your disease course as well. Ensure good control of your comorbidities by medication or lifestyle changes or both. And ensure the choice of your disease modifying therapy is appropriate, taking into account any relevant comorbidity or risk factors. And of course, communication, collaboration with your primary care providers and your other specialists, so they're aware of what your medical comorbidities are and what treatments you're on at the same time. Right, so that's it for today. Thank you. And so thank you, and thank you for listening to the discussion. And I hope you found this presentation informative.